सरकारान भलायकी सेवा संचालन, डायरेक्टरेट ऑफ हेल्थ सर्व्हिसेस, टाटा मेमोरियल सेंटर आणि ऑक्सफर्ड युनिव्हर्सिटी यांच्यामध्ये पणजे हांगा एका ऐतिहासिक समझोता कराराचेर सया केल्यो. मुख्यमंत्री प्रमोद सावंत आणि भलायकी मंत्री विश्वजीत राणे हांच्या खाशेल्या उपस्थितीत झाल्लो हो करार राज्यातल्या कर्करोग संशोधन आणि भलायकी सुविधांका आणीक बळकट करतलो.
Dignitaries on the virtually with join. Today marks a historical moment in the healthcare journey of Goa, and we have gathered here for signing of the Memorandum of Understanding, the Goa Cares Longitudinal Cohort Study 2026, an initiative that reflects our government commitment towards the building a healthier, stronger, and more informed Goa. I congratulate the Directorate of the Health Services, the Center for the Cancer Epidemiology at the Tata Memorial Center, Mumbai, and the University of the Oxford, United Kingdom, for coming together to create this landmark partnership. These collaborations bring together the expertise of one of the India's premier cancer research institute, one of the world's leading university, and the government of Goa, with the shared vision of improving the public health through the science, research, and evidence-based policy making. Friends, the healthcare being with the understanding why the disease occurs, how they affect people, and how they can be prevented before they become the burden on the family and society. The Goa Cares Longitudinal Cohort Study 2026 represents one of the most ambitious population-based public health research initiatives ever undertaken in our state. And through these initiatives, Goa joins the select group of the region and around the world, and that is in conducting the large scale, the long-term health studies designed to understand the changing health profile of their populations over the several decades. This is not merely the research project, it is an investment in the future health and well-being of the every Goan. Over the last few decades, India has made a tremendous progress in healthcare. However, we are also witnessing the rapid rise in non-communicable diseases such as the heart disease, diabetes, cancer, chronic respiratory illness, and the lifestyle-related conditions. These diseases have become one of the biggest health challenges of our time. In Goa, nearly 3/4 of the overall disease burden is attributed to the non-communicable disease. Conditions such as ischemic heart disease, type 2 diabetes, chronic obstructive pulmonary disease, and other lifestyle-related illness and increasing affecting our population. High blood pressure, obesity, high cholesterol level, and environmental factors have emerged as the major risk contributors. The data generated through the Goa Cares will help us to answer the critical questions. Why are the certain diseases increasing? Which populations are most vulnerable? What role do the lifestyle and environmental factors play? How can we identify the risk earlier interventions before the disease develops? The most importantly, the how we can create the healthier future of the people of Goa. The answer of these questions will help to shape the future healthcare policy, strengthening disease prevention program, improve the screening strategies, and support better allocations of the healthcare resources. The knowledge generated through this study will not only benefit Goa, but will also contribute to the national and the global understanding of the population health and aging and the non-communicable diseases. The Goa Care Studies is designed to follow approximately the 1 lakh adults between the age of 25 and 70 years over the period of 10 years. This makes it one of the largest and most comprehensive health study ever undertaken in Goa. Participants from both the urban and rural areas and will contribute to the valuable information regarding their health, lifestyle, environment, and family history. The researchers will study the factors such as the diet, the physical activity, environmental exposures, genetics, the blood pressure, cholesterol level, the blood sugar, and the several other indicators that influence the long-term health outcomes. The objective is simple and powerful: to understand how disease develop, identify the risk factor early, and create effectively strategies for prevention. Friends, for the many years, the healthcare system across the world focused on the primary on treatment. Today, the modern healthcare is increasingly focused on prevention. The greatest success of any health system is not only measured by the number of the hospital it builds, but by the number of the disease it prevents. The knowledge generated through this study will help us to design targeted intervention, strengthening the screening program, improving the healthcare infrastructure planning, optimizing the resource allocations, and formulate a policy based on the real evidence rather than assumption. Most importantly, it will help us to save the lives through the early detection and prevention action. And we have recently launched two healthcare campaigns in the Goa with the vision of making stronger and implementation and creating the awareness regarding the importance of the preventive healthcare and for the well-being of the people of Goa. Check by Dutor launched in the International Women's Day. It is targeted healthcare checkup of women of our families. Our mothers, our sisters, daughters, spouse, even though they are the one of that take care of our health and well-being of all the time in their health, and that goes unnoticed. I am proud to note that the 50,000